Charlotte Smith with Bladen Online, and it's this week's roundtable discussions
about our opioid epidemic in Bladen County. Mandy Cohen sent out a letter earlier this month on March 7th to colleagues of the Department of Health and Human Services of North Carolina. She stated that this epidemic has devastating results. More than 13,000 North Carolinians have died unnecessarily from unintentional overdoses since 1999. Communities in North Carolina have been ravaged by opioids, Cohen stated. Our state dispensed nearly 10 million opioid prescriptions last year alone. Yet, pain severity reported by patients remains unchanged. Prescription opioid use disorders are contributing to increased use of heroin and fentanyl, a powerful synthetic drug 50 to 100 times more potent than morphine. Additionally, illicit opioid use contributes to the spread of illnesses such as HIV and hepatitis C, Cohen reported. Although solving the opioid crisis will not be easy, our state is uniquely positioned to help end this epidemic, according to the Secretary. She gave 5 tips to providers on how to combat the opioid epidemic. The first tip, she said, was to visit the CDC guidelines for prescribing opioids for chronic pain. This guideline has been adopted by the North Carolina Medical Board, and free training and presentations are offered to providers and are now underway. The second tip is to register with the utilize the North Carolina Controlled Substance Reporting System, CSRS, to review patient prescriptions, histories, and incorporate them into clinical best practices around prescribing. Number 3, use DEA-compliant e-prescribing software where possible to communicate prescription orders more securely and accurately, especially for drugs that are prone to abuse and diversion. Screen patients to determine risk for or presence of opioid use disorder or abuse, and provide or connect them with evidence-based treatments. This web link that we have on bladenonline.com will show you the resources. Last but not least, number 5, she suggests transforming the addiction by talking about it and treating it as a treatable chronic disease. This information and the links can be found on bladenonline.com. We have reached out to several mental health providers in Bladen County, and none have returned our phone calls or emails requesting interviews or information about how someone with addictions may seek mental health or behavioral health services. If you know someone in need, seek help. Visit bladenonline.com for more information.